To make the most of every moment on the field, you need to prepare your plays and then put them into practice. Dentist Steve Marsh is here to run the bases on how a well-tuned team can help keep your teeth in tip-top shape. Welcome back to the show.
Thanks, Lori. Pleasure.
We know you love baseball. You go to spring training, you cheer on the tribe at home, but what does baseball really have to do with running a dental office?
Well, it's like you play a number of different roles. And by the way, Lori, here's a spring training hat. This happens to be the San Francisco Giants, but I'm a big Tribe fan, and this is one from my World Series signed by Omar Vizquel. That's where we hope to end up this year.
Of course, of course.
But just like our bobblehead here, Mike Hargrove, who was a player and then became a coach, a lot of what I do as a dentist every day is I am a player in terms of I do help function in terms of making a plan for the team and also for our patients, excuse me, but I'm also out there doing the work. So I think of myself in many ways as a player coach.
Okay. And so you have a team meeting though, right? Before you leave the dugout and get started for the day?
Yeah, every morning everybody's at my round table, very much like this, my whole staff, and we sit down together and we talk about our patients, who's coming in that day. And here we are looking together, and I'm leading that huddle as a coach, so to speak, and we talk about who's coming in. Do they have any medical problems? Who was here the day before? Should we follow up, or how do we follow up on them? And I think that's an essential part in any dental office, and maybe in every attorney's office, to be ready for the day, or physician's office. Who's coming and what their needs are, so we make sure we attend to what they have. Okay,
and before you head home at the end of the day, take us through some of the plays of the day.
Well, so one of the things we do is we work with our patients. We always update their medical histories. Things change over time. Sometimes somebody has a medical problem that they hadn't had before. This is Amy and Karen at our front desk. They're there to welcome patients and with that big smile to let them know they're welcome. And here's Amy actually reviewing a patient's dental history. Sometimes we do it outside in the reception area, and sometimes we do it right here at the chair. We make sure that before we do any work on a patient, we know what's going on. Somebody may be, especially in people in our Golden Opportunity viewers age group, they may be on a blood thinner, and that may impact how they're being treated. Or how they respond to different treatments. They may have high blood pressure. We want to make sure they're relaxed, and that may be taken care of with medication. So that's very important that we're all on the same page, just like a baseball team needs to be on the same page.
Yeah, because it's really important, that whole medical history thing. So, and then after you've kind of gone through things, they play the waiting game.
No, not in our office. We try not to have anybody wait. We call it a reception area because we don't have them wait. We have a refreshment area. There's actually a picture in our office. So we have things like snacks, we have water, we have coffee. Sometimes we have fruit out there, anything to make it happier. And these are patients who are here this week, and I hadn't seen this in a long time, Lori, and so I had to take a picture. They're looking at books, and I said, books? Everybody looks at a computer or the newspaper. They said, no, we're in a book club. We have a meeting this Thursday, and that's what we're doing. And in our reception area, we have before and after pictures because we want people to know what can be done. And this is a patient, a young boy of 18 who had lost a tooth. He wanted to have a beautiful smile. Was not a candidate for implants, and so we did some veneers. The reason we have a phone and my cell phone with a picture of my daughters and my wife, we use the text to actually let patients know and remind them of their appointments. And we use the phone at the end of the day, and sometimes in the evening, I'll actually get on the phone to any patient that we've done any work on that have been anesthetized to check on them. And they may have questions that they forgot when they were in my office because they're just happy to get out. I get that. So I check on them, and then we talk about what they may need in the way of maybe some pain medication, a warm saltwater rinse. And again, it's important for me to connect with them. So that's part of being a player coach. You set up the team, you take care of the patients, and then you follow up at the end of the game.
All right. You need teamwork to make a team actually work, along with a coach calling the right plays. Want to make your smile hit a home run? Give Steve a call. His number's next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com.